What causes hip pain in pregnancy? Why are your hips so sore? And how can you safely relieve hip pain whilst pregnant? If you're pregnant and dealing with pain in your hips, this video will help you to understand the most likely cause of your hip pain and give you tips on how to relieve it, including some simple exercises you can do at home. I'm Heather Booler. I'm the Deputy Clinical Services Manager for Physiotherapy here at the Park Hospital. In my 20 years experience as a physiotherapist, I've seen that hip pain can be one of the most difficult symptoms of pregnancy, especially in the second and third trimesters. If you want to know why you have pregnancy hip pain and what you can do yourself to make it better, keep watching. So, first things first, what causes hip pain in pregnancy? Far and away the most common cause of pregnancy hip pain is something called pelvic girdle pain, which is often abbreviated to PGP. The main symptom is pain, but you might also feel stiffness and not be able to move as well as normally. As well as hip pain, you might feel pain in your groin area, your lower back, or even your knees or thighs. PGP affects 1 in 5 women in pregnancy, so you are not alone. PGP doesn't harm your baby, and it doesn't last beyond pregnancy, but it can definitely make life difficult for you while it lasts. There are other conditions that can cause sore hips in pregnancy, including round ligament pain and sciatica, and it's really important to speak to a GP or physiotherapist directly about your pain to get a diagnosis and rule out anything serious. Now I'm going to show you a few exercises and stretches that you can try at home to ease your pregnancy hip pain. These have been designed to be safe during pregnancy, but you should always get advice from an expert before starting a new exercise program, especially if you're pregnant. So first exercise is pelvic tilting. So on a chair or a gym ball in this case, sitting up nice and tall, and then you're going to slump down and curl your pelvis and your bottom underneath you. Sitting up nice and tall, curling it underneath you. Try and keep your head upright and looking straight ahead. Imagine a glass of water balanced on your head, and we're making that movement come from that lumbar spine. Next exercise is side bending. So on a chair or on a ball, trying to sit up nice and tall, leaning down one way, stretch your hand as far away from you as you can. Try not to lean forwards, try and keep upright. Just go as far as you comfortably can one way, and then as far as you comfortably can the other. And just repeat a few times to either side. Third exercise, thoracic rotation. Seated comfortably on a chair or ball. Cross your arms in front of you, or you can hug yourself if you like. We're just then going to rotate as far as we can one way, back to the centre, and as far as we can the other way. And just repeat a few times either side. Exercise number 4 is hug and roll. If you feel comfortable getting onto the floor, leaning over and hug that ball. Rest your head against it if you like. Obviously allow your tummy to just rest down comfortably. And we're rolling forwards and trying to be at one with the ball. So as you're rolling, just go as far forwards as you comfortably can. I want you to feel in control of the movement at all times. Gently forwards, gently backwards, and it will really help stretch out that lower back. So exercise number 5 is on all fours if you feel comfortable. Try and have your hands underneath your shoulders, knees slightly apart. You're going to then try and arch your spine up as if you're trying to get your spine to touch the ceiling. Tuck your bottom under. Then we're dropping the spine down, sticking your bottom out. Imagine you're trying to get your tummy to touch the floor. And you're just going to go from one position to the other as far as you comfortably can. If you'd like to book an appointment with me or another physiotherapist near to you to discuss hip pain exercises, you can book online using the link below this video. We'll be able to tailor an exercise plan to your individual needs and hopefully get you feeling less pain and moving more freely too. So, like I said, if you want a personalised plan for exercises to ease your pregnancy hip pain, just book in with a Circle Physio at circlehealthgroup.co.uk. You don't need a GP referral, you can just refer yourself. And if you have any questions or comments, or if there are other videos you'd like us to make, we'd love to hear from you. Leave a comment below and we'll get back to you as soon as we can. Thanks for watching.